In my last podcast, I talked about relative proportions for rhinoplasty, and it got me talking a little bit about aging nose and aging rhinoplasty, and I thought I would do a dedicated podcast on that topic. The aging nose, what anatomically occurs is several things. One is that the outer skin envelope starts to become thinner, and then the bony elements of the nose becomes more visible, or the underlying cartilage becomes more visible. That is one component. The other component is the nose tip. People say it grows. It actually doesn't theoretically or actually in reality grow. What's happening is that there is this thing called a scroll. It's the junction between the lower third of the nose and the middle third of the nose. Those two pieces of cartilage called the lower lateral and upper lateral cartilages become weaker, and that scroll begins to separate so that the tip or the lower lateral cartilage starts to dive downwards and fall downwards so that the nose looks lengthened. I think probably the most obvious example of that is what a witch's nose would be, because when you see a witch with that kind of nose, you think of that person being older. Or Leonardo da Vinci, for example. When you see that some of the drawings of the older gentleman with the nose hanging down, you associate that with an aging nose. It definitely does not look youthful. So in this podcast, I'm going to be talking about two ways to rejuvenate the nose, one non-surgically and one surgically, and why those elements and ways to do it can make a difference for someone and who's a good candidate. So the non-surgical method of rhinoplasty is obviously just a filler. And so if you think about, if you listen to the last podcast on proportions for rhinoplasty, but in that podcast, I basically said if you raise the bridge, you can oftentimes make the tip look smaller. So if you think about this, if the tip becomes proportionally bigger as someone gets older, if you raise the bridge, you do two things. You cover the bone that's exposed, maybe a hump that's exposed that can also look like aging. You can cover that by filling above it in the area called the radix. You can expand the soft tissue envelope so that the skin, you don't see the bone underneath, which makes it look more youthful. And you can also make the tip look smaller, because when you raise the bridge a little bit, the tip in proportion looks smaller. So that is a very common strategy that I do for injectable rhinoplasty, is to inject the bridge of the nose with some fillers, of course using a safe technique, using micro cannulas to do that. And it just makes the whole face look younger. And a couple times this last week, I thought, why didn't I forgot to inject this patient's nose. I had injected her face the whole time, and I forgot the nose. And once you do that, it just makes the whole face look better. It's amazingly small amount of product. I can oftentimes do it in a quarter to half a syringe, and sometimes even less. And so the allocation of product is so minimal, and it makes such a big difference. What's interesting is, for me, oftentimes I prefer to do injectable rhinoplasty in someone older, because I'm already doing their whole face, and then I just add a little bit in the nose. It doesn't cost extra. For younger patients, they don't really need it in the face. Maybe they want their lips done, so then they have to dedicate a syringe for the nose. So in a relative sense, it's more costly, but and also over their lifetime, I have to keep on dedicating for the nose. I always like to use the nose as a bonus when I do injectable rhinoplasty rather than as a standalone, but ultimately it doesn't really matter. I mean, if you really are focused on the nose, you don't want to do a surgical rhinoplasty, then injectable rhinoplasty could be suitable for you at any age. The surgical rhinoplasties, I perform quite a few aging nose rhinoplasties. One category would be a rhinophyma reduction, which is the nose that gets expanded and enlarged because the oil glands get bigger. It's an end-stage type of acne rosacea, and that you shave down the skin, which is a very unique thing. You can look at some before and afters on my website. That typically occurs more in males, and typically in fair-skinned males. And then if you think about the witch's nose is a classic sign of aging. And so if the nose tip has been dependent and hanging, you just raise the nose bridge a little bit, the person looks younger. If there's a hump, you just take the hump down a little bit, and the person looks more youthful. For men, psychologically, the other thing to consider is that as they get older, sometimes their self-image becomes more static and less mutable. So that if you take a hump down on a man and change his nasal tip, after the age of 45, really for heterosexual men, that may be a slight negative for them because they probably are used to their nose. Whereas it's interesting with women, I can do a rhinoplasty on a 65, 70-year-old woman, and the woman feels as if that new nose is something they've had all their life. Now, of course, these are differences that may not be 100% applicable for every single individual, but these are just basic psychological principles that are there as well. So aging rhinoplasty is something that I do quite a few of, both injectable as well as surgical. And I just want to talk to you about some of the principles of what I'm trying to achieve and why it may be beneficial for you.